Hey, welcome to another episode of Clear Lake Connections, where we talk to the people behind the businesses of Bay Area Houston, proudly sponsored by UTMB Health. Today's special guest, you are the Chief of Pediatric Surgery at UTMB,
Yes.
Dr. Bindi Naik-Mathuria.
Yes, thank you so much for having me.
And the reason you're on is you recently authored a paper. Tell us about that. It's an interesting topic and one that certainly needs more light shed on it.
Absolutely, thank you. So it's regarding gun violence, but particularly to children. And so I don't know if a lot of people are aware, but now it's the leading cause of death in children of all ages. That beats motor vehicle crashes, car accidents, cancer, heart disease, anything. In America, it's the leading cause of death. And so as much as we like to, we may like to pretend it doesn't exist because it's just a sad topic, and of course there's a lot of political issues around it as well, it's something that as doctors and as a public health researcher, I've always been really passionate about. I've taken care of many, many children injured by guns. Children are innocent most of the time. Sometimes they find a gun in the wrong hands and they shoot themselves with it, or they're shot by another child, or they're a bystander, just happened to be in the way. There's, of course, suicide, and that's a big mental health problem, is an increasing problem in children. And then, of course, there's the interpersonal violence that has to do with domestic violence, sometimes child abuse, and then sometimes gang-related and street violence as well. In all of these cases, children are affected. And the reason I got interested in this is because there's really not been we don't have a good handle on how often it's happening. So if you look at all the media stories that talk about gun violence, a lot of them focus on mass shootings. Yes, those are really, really sad and horrible, but they're really just a really small proportion of everything else that's going on. And then there's a lot of focus on deaths. So you hear a lot about homicides and you hear a lot about suicides, but there's very little knowledge really on the ones that don't die. And as someone who's worked in many trauma centers and has cared for these children, I can tell you that most of them don't die. But they're still affected by gun violence, right? So they may have long-term disabilities. They certainly have psychological trauma and things like that. And so I just felt that if we want to try to get a handle on what's going on so that we can think about ways to prevent it, that we need to understand the full picture of what's going on.
Yeah, and UTMB seems really interested in the public health.
Yes.
So that it was a natural fit for you to be able to take this on.
Absolutely, yeah. I have a degree in public health. I find it very interesting. As a doctor, you can help the few patients that you help. With public health, you help many more people. You can reach many more people. And it also has to do with injury prevention. So I think of it in the same ways I think about bike helmets, or seat belts or car seats, drowning prevention. I mean, it's really just preventing injuries. In this case, it happens to be preventing injuries from guns.
So you said that, I guess it was kind of an inflection point because it's now the leading cause of death. When did that?
2020.
And that's okay. So that
in 2020 is when the lines crossed. It used to be car crashes for many, many decades, and then they took over. There's definitely been an increase in both adults and children throughout the country on deaths and injuries due to guns, starting in 2020. Whether or not that's related to the pandemic, I think is...
maybe as people get on the road again more.
Yeah, may or may not be related. Yeah. I think it's unclear, but certainly it has gone up since then. Mm-hmm.
And you had mentioned a lot of factors for that, but what are you seeing here locally that we need to pay attention
it's
to?
Certainly more in Houston and some of the other reasons. So this particular article focuses on the national scene, but I also do a lot of research on just Houston area, Harris County, that area. And it's certainly gone up. I mean, it's gone up more than 80% in the last few years, which is really scary. And we see it in, there's different types of gun violence, right? As I mentioned, there's the accidental, there's the suicide, there's this and that. So each of them is very different. So, for example, the suicides we see more in the suburbs, particularly if you talk about Harris County, the northern suburbs. It's more prevalent in middle school children. It's more prevalent in Caucasian children. And then unintentional or accidental injuries are everywhere, suburban and urban, certainly rural. So our population here at UTMB, we draw a lot from the rural cities, counties. And the unintentional or the accidental shootings were really high. So are suicides in children. And so it's important to know these things because it's not just a one-size-fits-all solution. It's not as easy as bike helmets, right? So how do you prevent these? So for suicides, it may be different. It's about recognizing mental health, depression, and in what age group and which race group and which gender group are you looking for. For accidental shootings, that one's easy, I guess. Just, don't keep loaded guns near children that can access them. But also knowing what ages. For example, a lot of people don't know that a 2-year-old can pull a trigger. And I've seen it. I've seen them come in having pulled a trigger, and people don't realize that. Then there's a lot of misconception about, I taught my child to stay away from a gun, where studies have shown over and over again that it's not enough, that children are curious, and even if they've been taught, they often still are curious about it. And so so I think understanding what's going on and then trying to identify the risk factors for each age group and for each shooting type can then lead to prevention from every angle.
But the number one thing is keeping the guns locked up.
Yeah,
and away from the kids, basically.
To prevent the accidental injuries and the suicides, absolutely. That's the easiest. That's number one thing for sure. And what we found in this study, sorry to interrupt you, is that a third of the injuries and deaths in children were either accidental or suicide. And so I think that really, really emphasizes that safe storage would be an important way to prevent those types of injuries for children.
Yeah, and you had mentioned that actually more are surviving than are that are.
Yes.
So the number of people dying is at a record number, but that also means the number of people
getting
being
injured.
shot and not making that list.
Exactly.
Talk to me a little more about what I would imagine a bullet would have. The smaller the person, obviously the bigger the damage. Talk about that a little bit.
What you see on the outside is just the tip of the iceberg. So when a bullet enters a body, it forms it has a blast effect. It almost forms a cavity. And so what you see on the outside is just a small hole. It's like 5 times wider on the inside in some cases, depending on how close range the bullet was and what the speed of the bullet and the caliber and all of that kind of stuff. But generally the damage is a lot more. It's not just like a single tiny thing zipping through the body. Mm-hmm. And so on a child, you may have a blast effect. Say a blast effect is this wide. Now I know we're on, I don't know how many centimeters is that to describe that. Say it's 10 to 15 centimeters wide, and it goes through the liver of an adult, right? That may just take out a small portion of that, maybe not as big of a deal, but that's going to take out the majority of a liver of a child, right? And so the damage can definitely be more pronounced in children. So some of the non-fatal injuries that we see, some of them are small, right? Just going through the hand, for example, or the leg or things like that. But there's others that, I took care of a child that had one bullet, just a stray bullet that went through his abdomen and came out of his back, injured every single organ in his body, including the major blood vessels. And yes, he lived, but he was in the hospital for 7 months, and he has lots of pain and problems walking and all of this kind of stuff. And so we can't just ignore those. We can't just talk about the deaths. It's the same thing if you think about car crashes, right? Yes, the ones with fatalities are bad, but we want to prevent all of them, right? So it's the same concept.
So how'd you get into pediatrics?
Oh, well, I've always loved kids. I always thought I was going to be a pediatrician, actually, and then I fell in love with surgery during medical school. And then when I learned that there was a field called pediatric surgery, I thought that was a dream job, and it's been true.
And how long have you been with UTMB?
Actually, I'm fairly new to UTMB. I just started, it's been only less than about 6 months. Prior to that, I was in Houston at Texas Children's for most of my career.
And are you enjoying it? Because all the doctors I speak to, they talk about the culture there and how welcoming it is.
Oh, absolutely. I can 100% attest to that. Yes. It's the people really make the place, and it's absolutely a welcoming culture and very supportive. So I've been very happy. Yes. Thank you.
Well, congratulations on the study. Anything else you want to tell the audience before we part?
Well, I just think that everyone can play a part, and sometimes I think we certainly don't see as much gun violence in for example, Galveston, in this area, as much as it is in Houston, but that doesn't mean that it's not there, and that we can avoid it. So I think everyone should play a part, and if you're a responsible gun owner or a non-gun owner, everyone can play a part in making sure that we're all safe.
Well, I thought it was interesting. You said that UTMB serves a rural, suburban, and maybe a smaller urban.
Yes.
So you're seeing all the different types at that point.
Absolutely. Yes.
Okay. And then for a lot of our audience being suburban, you said to focus on, basically the suicide one.
So suburban is suicide and accidental injuries are definitely, we like to call them unintentional because they're not an accident. They could have been prevented, you know? And so, those are most common in children in the suburbs for sure. And for that, safe storage of every single gun you have is absolutely important. People like to own, guns for self-protection, and so, locks and things like that can be cumbersome, and I understand that. But there's great options. For example, the fingerprint safes is just as quick as opening your cell phone. That's one. If you can keep it in a bigger safe or somewhere farther away, that's always best. At least separating the ammunition. There's different ways of doing it, but I think the key is just recognizing that it is a risk, just as dangerous as a car might be for a child to get in a car and drive it. It's the same thing getting a gun, and as much as you tell them not to do it, doesn't you can't rely on that. So
because I remember I must have been in junior high, and I was over at a friend's house, and he had gotten a gun out, and I remember he was waving it around, and I'm like, looking back on that,
could have ended very badly.
It could have easily been, that type of situation.
And we see devastating stories like that all the time, and it's heartbreaking, and no one wanted that for their kids. It's not like they left that gun out on purpose. Of course not, right? Everyone tries to be responsible, but I think that it's just raising awareness that it's not enough to just, and some people think, for example, I can just hide it in a closet. Well, kids find things, right?
Yeah,
they
like
find
Christmas presents.
They find Christmas presents, so they'll find that, and so I think just emphasizing that, and I think there's a sense of, it's not going to happen to me, right? That's a common, maybe it's a self-protective thing. Getting around that, right?
Yeah.
Like, it could happen to me, it could happen to my friend, it could happen to anyone.
If you have kids, you realize they lack impulse control.
Yeah, exactly. And teenagers especially, right? And so a lot of the teenage injuries are seen sometimes maybe with their own weapons, right? With their own guns that they have while they're cleaning them or something like that, or just showing them off to their friends. And so it's fine to let teenagers have guns, but again, it comes with responsibility. So maybe they should just be handling them when they're around adults, and then be given back to adults or something like that. And then certainly in cases where teenagers, and sadly this starts, the mental health thing is starting, like this, the number one cause of death for middle schoolers is suicide, which is just crazy to think about, right? By firearm. And so even at that level, it may be best just not to have a gun in the home at all, especially if a child seems to be depressed or anxious or something like that. It's just too easy, So
well, I want to thank you, because the next time one of my kids says it was an accident, I will say, no, it was unintentional.
Exactly.
So you've given me a valuable tool to interact with my kids.
Excellent.
Well, thanks for being on.
Absolutely. It's such a pleasure. Thank you so much.